Exegesis Health Communication presents Resilience, Recovery, and Pandemic Preparedness. The United States is a central player in the global innovation ecosystem. Our small businesses supply millions of families with goods and services necessary for a modern life. We are an innovation nation, we are resilient, and we possess the courage and compassion to face the challenge of recovering from a global pandemic. The economic impact on our nation's innovation ecosystem is significant. According to the National Bureau of Economic Research, the U.S. entered into a recession in March of 2020. The health impacts are real, with more than 42 million cases and over 630,000 deaths. Hospitals, nurses, doctors, families, and communities have borne the brunt of the pandemic. While non-Hispanic white people are dying in the largest numbers, Blacks and Hispanics across every age group are dying at a much higher rates. Black Americans are 2.6 times more likely to contract COVID-19, 4.7 times more likely to be hospitalized, and 2.1 times more likely to die from COVID-related health issues. This presentation is being made for everyone who's not a scientist, everyone who's not a nurse or a physician. This is an effort to help the community, the broadest community possible, to get an understanding of what the current epidemic and pandemic is about in the United States. What is COVID-19? Where did it come from? How did we get to the point to where we were able to develop a vaccine? We're going to present as actual timeline, and this timeline will help you to understand exactly how we got to where we are today. So beginning in 2002, we're going to look at the very first coronavirus that gained international attention. And the very first SARS virus was a coronavirus. It was discovered in 2002. It infected 8,000 people. It had a mortality rate of 10%. Now, that wasn't so bad because the actual community that was dealing with it in Asia, they were very quick to actually take emergency preparedness practices. They put those practices in place and immediately was able to go ahead and to prevent a actual large-scale infection of the population. The next coronavirus that emerged that gained international attention, it's called MERS, and that was basically originated from communities in the Middle East, and that's how it's named, the Middle Eastern respiratory virus. And so this coronavirus infected 2,300 people, but it had a much higher mortality rate. 35% of the individuals infected succumbed to the actual disease. When we look at, we had a 7-year gap between the 2012 outbreak and 2019. And we see a second SARS coronavirus emerge, and that's why it's called coronavirus 2. In the media, we begin to call it COVID-19, and that emerged in 2019. The early infection rates that were identified in 2019, we see that 8.7 million people were infected. 400,000 people died as a result of those infections. Moving into the 2020 season, we see that 83 million people have been infected with COVID-19, and we see 1 million deaths. What you have to recognize is that the biomedical research community, the biomedical innovation ecosystem, has been studying coronaviruses for over 18 years. And as a result of that, we have developed a variety of actual vaccines to address these emergent threats. The genetic sequence for COVID-19 was published January 11th, 2020. That sequence data was used to actually now to design strategies to identify vulnerabilities in COVID-19. These actual targets we were looking at, we used those targets to actually develop vaccines. The first major vaccine that was produced in China. and that was released in June of 2024 of 20. The next, the Russian Sputnik vaccine was made available in August 11th of 2020. Then the Israeli Pfizer BioNTech collaboration, they basically identified a actual vaccine platform that they made available in December of 2020. The Food and Drug Administration in the United States has an actual program for dealing with organisms that are really infectious diseases that can be quite threatening to the population. And so this is their emergency use authorization program. Through the emergency use authorization program, the actual developers of the new technologies have to present a dossier of data to the FDA for evaluation. And once they provide that dossier of data to the FDA, then they are now allowed to distribute that into the actual population. So the very first EUA vaccine that we had was from Pfizer BioNTech, and that was made available in December 2020. The next vaccine that was to get the EUA permission was the Moderna vaccine that also was released in December of 2020. The third EUA vaccine in the United States was from Janssen Biotech, Johnson & Johnson collaboration, and that particular product entered the distribution February 27, 2021. So by this time, what we recognize is that globally, we're looking at 216 million infections. We're also looking at 4.5 million deaths. In the United States, at one time we were leading the world in infections. We basically have currently 633,000 infections and 39,000 deaths. So now we're into 2020. And what we witnessed is the emergence of a new variant of COVID-19, and it's called the Delta variant. And so the Delta variant basically took hold and moved across communities this past summer. And so this is what we're looking at called the Delta summer. And this particular variant was much more infectious than the original strain that came to the United States. And it has been responsible for filling up our actual hospitals across the country. The next development in vaccine development, we have the first FDA authorized COVID-19 vaccine. That was the Pfizer BioNTech vaccine that was developed in collaboration by Pfizer and biotech, as well as with researchers in Israel. Now, that particular product, we see that there's substantial amount of data on the safety and the effectiveness of the actual vaccine in healthy men and women. We also was fortunate to be able to get more data on who is most at risk of dying from COVID-19 infection. And so during this particular time, it became quite evident that individuals with comorbidities, for example, diabetes, hypertension, and obesity, individuals who have combinations of those at the same time that they come down with COVID, those individuals unfortunately have the highest risk of dying from the actual infection, becoming hospitalized. And for those individuals who do survive, those individuals can have a tremendous road of difficulty as a result of that. Now, the FDA authorized the first COVID-19 vaccine, fully authorized. That was August 23rd, 2021. So that particular vaccine came onto the scene at the end of the actual Delta summer. And so we're looking at how that's going to actually play out and have an impact on the rest of the actual population. We also have boosters that are also being developed. Now, the boosters that are being developed for individuals who already have a variety of immunocompromised situations, individuals who may have also comorbidities who couldn't take the full 2-dose schedule. So they're looking at finding ways to try to boost the actual effectiveness of the actual vaccines in light of the actual evolving new variants. We recognize that the Delta variant has had a significant impact on the actual health and welfare of the U.S. population. We also recognize that because of the rate of actual mutation in the virus, we may see other variants that somehow may be more stringent, may have a higher pathology profile, may make people sicker, and may have a higher mortality profile. So ongoing research is constantly going on in the product development arena to try to stay ahead of any new emerging variant that could actually be worse than what we're dealing with right now. So you're looking at these new boosters are being evaluated at 166 sites across the world. Currently, globally, the vaccine doses that have been administered is over 5 billion doses. Now, that's pretty tough because some of these particular products, the majority of these products, need 2 doses for you to get full immunity. Some individuals who are very healthy are showing a very robust immune response after a single dose. This particular slide shows us the actual emergence of the COVID-19 variants over time in the United States. What we can see here in the blue area, this blue area here represents the actual COVID-19 variant that was responsible for most of the disease from April 2021. This is the Alpha variant 201. It's the Alpha variant, and that's contributed to most of the infections in the United States. Now, since July of 2021, we're looking at Delta summer. Since July of 2021, the 21A Delta variant, known as the Delta variant, that particular one has basically been responsible for contributing to mass hospitalizations in unvaccinated populations across the country. As you can see, we don't see that many alpha variants responsible for infection. Here we see from July on, we see that the Delta variant is the dominant variant, and it is causing the most actual impact on the portion of the US population that remains unvaccinated. This is the strongest case that can be made for you actually getting vaccinated before you actually have to encounter the Delta variant. So people want to know, how do vaccines work? And what vaccines do is they basically help you to actually defend yourself. And so we see here the Delta variant has emerged. We also can see not only here in the actual green, but we see it's become the dominant waveform as it moves across the population. Delta variant. Hopefully we can get the population that remains unvaccinated in the United States, hopefully we can get folks vaccinated before a new variant emerges with greater pathogenicity, greater mortality. That is the concern, that is the fear. So someone says, well, what happens when a healthy person gets the actual COVID-19 infection? So you basically will develop antibodies. Most of us, 80% of the people, will undergo an asymptomatic stage to where we're without symptoms. After that asymptomatic stage, that is part of what's an incubation period. After that stage, when the actual COVID-19 virus is replicating, reproducing itself in your system, its levels reach very, very high. And so during that time frame, your immune system is actually learning how to defeat it, learning how to shut it down. And so the very first antibody that the body makes is called IgM, and they are specific to targets on the actual COVID-19 virus. The next class of antibodies that they make are the IgAs. We see that those peak right here as the actual messenger RNA that is a part of the actual COVID-19 virus, as its replication is being slowed by the first two antibodies that your body made. We see that it's actually slowing down the rate of replication of the virus in your body. We also see the third antibody in the actual series of antibodies. It's called IgG. Now the IgG ramps up, and so as it ramps up and peaks, we see the combined impact of IgM, IgA, and IgG. These three classes here are targeting multiple targets in the actual COVID-19 virus to actually suppress its replication and bring that replication all the way down. We also see that the IgG antibodies persist. We also see that the IgA antibodies persist, and we see that the IgM antibodies decrease over time. This is the human immune response as it relates to the antibodies that are developed. Now, what the vaccine does is it provides our immune system with the most effective targets for controlling the COVID-19 virus. And what you're looking at here is your immune system is learning and identifying and adapting, trying to select the best targets possible to suppress the virus replication. What we do is we give you a vaccine that has already identified those targets. So now your immune system can focus in on the target that's the highest priority, that's the most effective at actually suppressing the virus being replicated in your body. And that's what the immune actual response is about. That's what the actual vaccines do. They're not a drug in the sense of a actual new chemical entity. These basically are basically the actual targets that your own immune system would use to actually go ahead and figure out how to actually suppress the virus. All we do is shorten that learning period for the immune system so that it can be much more effective and prevent individuals from going to the hospital, prevent individuals who are already vulnerable, who may have comorbidities, diabetes, hypertension, obesity, the combination of the big three, help those individuals now to be able to mount a very effective immune response, avoid a hospitalization, and potentially avoid death. This is what it's all about. And so that's basically what the actual program is about, is to help you to understand basically what is happening in your body and what the immune response is about and why getting vaccinated makes a big difference. Unfortunately, the individuals who have died the most from COVID-19, yes, although we have non-Hispanic whites are the largest group of individuals in the United States who have become infected and have died. But unfortunately, African Americans and Hispanic Americans have died at much higher rates that are disproportionate to their representation in the actual population. So when it comes down to a health equity standpoint, the pre-existing conditions in these communities has made them extremely vulnerable to infection, extremely vulnerable to hospitalization, and 2.1 to 2.4 times likely to die from these infections. So for all of us, let's make sure that we have a clear understanding of the opportunity available to us, and let's work together to go ahead and make sure that our communities can stay resilient and we can now refocus on rebuilding our economy and getting back to our way of life. I'm Dr. Joseph Curtis. Thank you very much. Building upon what we learned earlier This animation enables us to visualize how vaccines accelerate our immune system's learning curve and provides us with immunity. Vaccines present our immune system with the targets that stimulate the most effective response for neutralizing the virus, reducing your risk of hospitalization and death. The COVID-19 RNA in blue was used as a template for vaccine development. Depending upon its configuration, a vaccine can contain instructions for the spike protein, visualized in red, and the viral replication enzymes. The spike proteins are important because they contain the binding sites that allows the virus to attach to our cells, initiating disease. Your immune system recognizes these antigens and targets them for action. In response to the vaccine, your immune system produces a robust immune response, supplying enough antibodies in purple to neutralize the COVID-19 virus. These circulating antibodies remain present in the body long after vaccination to protect you from future infection. In some instances, a second dose and even boosters can also enhance the immune response, reducing your risk of disease. Out of the ashes, a phoenix rises. America is more than a nation, it is a continuing story of reinvention. In the immediate and near future, the steps we collectively take can lay the foundation for a new American economy, one that works for us all. Health equity is a requirement for the full realization of our individual and collective human potential. The task of restructuring our healthcare delivery system is a prerequisite for an innovation nation. The post-pandemic period will be defined by the themes of social equity, imagination, innovation, and transformation. Each one of us is a co-creator in an equitable healthcare system that respects the dignity of all human beings.